The heart is the pumping chamber that sends blood through our body to all of the key organs. It needs to work well, or that blood flow is not going to be adequate, and that leads to damage to any or all of the organs in our body, be it the brain, the kidneys, the intestines. Everything else is dependent upon its proper function. Unfortunately, the state of heart health in Harris County is not as good as it should be.
There is an unevenness in heart health in Harris County depending upon where you live. There's an unevenness depending upon the color of your skin. There's an unevenness that is difficult to explain except when you begin to consider some of the social drivers of health.
The social determinants of health are really a confluence of factors that influence the way people live, eat, play, and pray. It's those environmental factors in the neighborhood, and even societal things such as income level and achievement in school. It can be things like, do you have access to adequate food and the healthiest food that you would need to live a long and healthy life, as well as places to be physically active. Is the neighborhood safe?
Very often we think of access as being able to get into a facility, but it may be even more fundamental than that. It may be transportation. In the area of town that they live in, is there adequate bus service, for example? Here in Houston, we have the largest and I would say the greatest medical center in the world, but it can also be intimidating. It can be intimidating in terms of its size. It can be intimidating in terms of who do you call? How do you gain access? And that, as simple as it sounds, can be a real challenge for some.
One thing we know for sure, it's not a level playing ground across even a big city like Houston. From one zip code to the next, social determinants of health can really vary.
Mortality from heart disease has actually decreased dramatically over the last 40 years. Since 1940 or thereabout, it's decreased about 70%. What a heart attack is essentially damage to the heart muscle, so the heart can't pump as well. And so what that leaves you is with a condition called heart failure. Basically, the inability to function properly because the heart cannot pump as much blood as it needs to function properly. In the past, there were about 6 million Americans with heart failure. That number is now increased to about 8.5 million, so a 30% increase. And unfortunately, lower socioeconomic classes, the underserved, those unable to get good access to good health care and information about good health have a larger incidence of poor health habits, and that translates directly into bad heart health.
High blood pressure, diabetes, smoking, high cholesterol, all are modifiable risk factors that contribute to hardening of the arteries over time. And then there are things that you can't modify, like your genetic predisposition, the heredity that you have. If you look at some of these modifiable risk factors, they're going up. The prevalence of obesity across the United States and also in Harris County, it's going up. And that obesity is driving a lot of the high blood pressure and the high cholesterol and the diabetes. There are social barriers that are precluding people from achieving health equity or the optimal kinds of health outcomes that we as a community can focus on.
We focus on systems level change, which is if a community doesn't have access to physical activity, that environmental change could be a trail or a safe place to walk or a safe place to play, such as installing a playground. If a community doesn't have a system of access to healthy foods, we can work with a community partner and work with them to put up something like a healthy food pantry. One of those collaborations that we've been able to grow has been with the Urban Harvest organization. They're great partners, and we've been able to get food to communities through mobile farmers markets. And we also work with the Houston Food Bank and a number of other really big partners that are doing incredible work in the space of providing healthy food. And then of course clinical partners are really the mainstay, I would say, of some of our systems level change. And so we work with almost 200 clinical sites across Greater Houston, ensuring that people's blood pressure is measured accurately, that they have the best possible intervention in the clinical space.
90% of people with heart disease have at least one of the risk factors that we've talked about. So for example, 40% of patients with heart disease have obesity, 16% of them are smokers, high blood pressure also about 60%. So these statistics all underlie, if we could get rid of those risk factors in our patients at risk for heart disease, we'll be well on our way to eliminating heart disease completely.
Some of the things that a community can do to begin to address heart disease are to really develop a deeper educational program that helps people understand the ways they can influence their own health.
I think it's important for a patient to take an active role in their own health care.
We have effective strategies to lower blood pressure, to lower cholesterol, to manage diabetes. It takes a deep personal commitment to exercise and to change the way you eat. But if we can find a way to pull all of those aspects together, I think we can begin to bend the curve on cardiovascular morbidity and mortality and improve the longevity of the patients in the community. And if we can get to that point, I really think that we can have a positive impact on cardiovascular health.